As of midnight tonight, Trinidad and Tobago will be under a state of emergency, which will also include a curfew between 9 p.m. and 5 a.m. The announcement from Prime Minister Dr. Keith Rowley earlier today, Saturday, after continued reports of an increase in both COVID-19 positive cases and deaths. Brown-Campbell tells us more.
A state of emergency has been implemented to control the wildfire spread of COVID-19 cases, with its spiraling death toll that is sweeping across the country. Prime Minister Dr. Keith Rowley made the announcement at the Diplomatic Center on Saturday.
From midnight tonight, Trinidad and Tobago will be under a state of emergency involving a curfew that from then onwards would be 9 p.m. to 5 a.m.
Prime Minister Dr. Rowley described the dire circumstances that led to the decision. He further noted the parallel healthcare system will soon be unable to keep up with the increasing cases.
We are now dealing with 21 deaths in one day, and if you bring that down to per hour, it's almost one person dying every hour. That is a frightening situation. And of course, if that is allowed to multiply, very soon we would be happy when it's only 21, because it could go to a number where 21 is a great improvement.
The Prime Minister disclosed the sectors and personnel who would be able to operate outside of the SOE.
National security in all its forms, of course the health department in all its forms, the Ministry of Energy's work, the energy sector will remain under. The utilities will remain exempted. Ports and airports will remain exempted. All tentacles of the food supply chain.
He said pharmacies, public transportation and elements of the public sector would need to be exempted so that workers could continue to receive their salaries. Details of the state of emergency will be fleshed out by the Attorney General. Brown-Campbell, TTT News.
And shortly before the Prime Minister's announcement of a state of emergency, the Ministry of Health's Principal Medical Officer, Dr. MARYAM ABDOOL-RICHARDS, explained that this country's parallel healthcare system is facing troubled times. She said the healthcare system was at a touch-and-go stage with a 73% occupancy at hospitals in Trinidad.
Please do not be comforted by the fact that we have 27% more occupancy level. As I've been indicating, and as you all know, a bed is no longer a bed. And even though there may be physical beds, the resources that are required to give you the best level of care may not and are not available.
Dr. Abdool-Richards said all intensive care unit beds were occupied, with the HDU now at 95% occupancy.
The ICU level, all beds are filled, and we are in the situation of having to add beds, convert beds, add ventilators on a daily basis. The ward level beds are currently at 66%, and our new step-down facilities are at 57% today.